Hello, my friends. Here's my voice. I'm a little hoarse. I'm all tubes. They stuck in my throat. Um, so I recently had a health crisis. I believe it was on the 6th or the 8th of this month, April. I remember very well. I was exercising. I finished exercising and everything, hitting the heavy bag, and then at night I felt this pain right here in the whole abdominal area, but it was horrendously excruciating. And I thought maybe I pulled a muscle, but it would not subside. And my dumbass stayed at home trying to nurse it with Tylenol, but it was just very, very hard. I was able to sleep here and there. And the next day I could barely walk and stuff, and then I couldn't breathe very well. I have to, if I cough, I have to make pressure with a pillow because I have an incision. I'll show it to you in a little. So Wednesday, that was on Monday night. Wednesday, told my friend, say, hey man, take me to the hospital. And then I went to the hospital, went to a emergency clinic first, and they saw me because I right underneath the liver there was a little bump that developed. It's like that's not right. So I went. They sent me there. The clinic said you gotta go to the hospital, man. So they sent me to the hospital, and in the hospital, surgery. I had diverticulitis, and I had the worst form of it. I had diverticulitis, but I've never been infected or anything. So this one got infected apparently, and all the movement, and I don't know about the movement. Something got stuck in it and got infected, and diverticuli are like little sacs, little bubbles that develop on your large intestine. And I had one on the ascending transverse junction. Your colon goes from your right side, ascending colon, then transverse colon, then descending colon, then sigmoid colon, then colon, which is where you poop. So in the junction of the ascending and the transverse heading to my left side, a little diverticulum got infected, got filled with pus, and then it ruptured a little at the bottom. It let out some of the pus, and it started an infection in my peritoneal cavity. And my body encapsulated that infection, and it made um, abscesses. It started going into my blood, started getting septic. So if you feel something really, really bad like that, some pain, go straight to the hospital, don't wait. So they treated me with antibiotics. At the beginning, they said, let's try it to see if it'll go down. They had to treat me with antibiotics to treat. I came out with E. coli in my blood. So they treated that, but it just kept getting worse. And on the 16th, they operated on me. They put me on no fluid, no drinks, no food for days. And try to give it a rest. Sucked because you can't drink anything. You're all dried up. And it's scary because you're in a hospital and they got COVID patients. The rooms, they tested me with code for COVID because I had a fever. But the fever was from my body fighting the internal infection and the blood infection. So I tested negative. But it's nerve wracking. So I always kept gloves on in the hospital, and I have my trusted friend here, my soapy water spray bottle. I took it to the hospital with me. This is a pair of underwear that they give you at the hospital, and I make my mask with it. And then gave you a mask when I went in there. I had one when I went in there, but it's still, the same nurses that are treating you are treating patients with COVID, and they do change their gloves and all that stuff, and they have masks on and stuff, but it's still nervous. So I was in there over 2 weeks. On the 16th, they took me to the operating room, and they opened up my gut. And they cut a piece. Notice how they go around the umbilicus, your belly button. That is allegedly to prevent hernias. I have a little bump down here. I don't know if it's a hernia or not, but I don't think so. It's just they open up that thing and they open the skin, then they cut your muscle, open the muscle, and they pull your bowel, your intestines out, and they cut and they resaw. Man, when I came out of it was a 4-hour surgery. When I came out of it, I wasn't, still had sedation, but I coughed one time and it was like somebody stabbing me. So every time I cough, I put a pillow over my incision to hold it in place. Man, but I tell you, that's the most painful. They gave me, in the beginning when I got to the hospital, they gave me a shot of morphine. It helped a little. They gave me Toradol. It's supposed to be anti-inflammatory. It helps with the pain. Morphine makes me nauseous. I don't like it much. Then they changed me to a really small dose of Dilaudid, like 2 milligrams every 3 hours. It helps a little. I didn't want much. In the end, at the beginning, they don't feed you anything I came out of surgery with a tube, a nasogastric tube, to pull out all the secretions out of my stomach so they wouldn't go into my intestines. And they would give it time to heal. And I couldn't drink or eat anything, they were feeding me IV. And potassium and, salt, the salt, saline and some dextrose. No food. And first few days was really hard because the gas pain and the spasmic pain from the operation site and everywhere. It was just so painful. Then they changed me to oxycodone 5 milligrams. And that helped a little more. That's every 6 hours. Gave me about an hour and a half of rest. But all in all, it's been it's been very trying, painful. So if it's the 28th, I think, It was on the 16th. It's been 12 days. And I still don't. Feels like when you get up and you're walking around like like your intestines are going to come out. It's painful. You have a hard time breathing at the beginning because you don't realize how much you use your stomach muscles, your abdominals in breathing. So you're trying to protect them consciously so you don't use them as much. So you're just lung breathing, as we call it. But, you know, lesson to be learned is if you get a strong pain like that, don't wait. Go straight to the hospital. Maybe I could have gotten away with this treatment with antibiotics and it would have subsided. Never know. We'll never know that. But maybe. Take care of yourself. Stay safe out there. Grateful got another shot to live. I hope it can continue to get better. And please be safe out there.